Elsewhere, the number of COVID-19 cases is rising in Asia. In South Korea, the situation is worsening with 583 new cases confirmed today. This is the highest since March as the country grapples with a third wave of infections that appears to be worsening despite tough new social distancing measures. South Korea has relied on mobile phone data, credit card records and closed-circuit television footage to track transmissions. But the new wave presents a challenge as many small clusters are happening in vastly different locations. Since Tuesday, restrictions on social gatherings have been tightened in Seoul and Greater Seoul. Meanwhile, Hong Kong is seeing a resurgence of COVID-19. An expert who spoke to the Straits Times believes the fourth wave arrived soon after the third ebbed in early September, as measures were eased then before local transmission was eliminated. The city reported 80 new cases today. Joining me now to share more on the situation in Hong Kong and South Korea respectively are the Straits Times' Hong Kong correspondent Claire Huang and South Korea correspondent Chang Mei Chun. For a start, could you briefly tell us what is the cause of the new waves? Let's start with you, Claire.
Well, it's a combination of local transmission within the community that was not completely eliminated after the third wave that sort of tapered off in September. The rules were then eased quite soon, and of course, there was October festivities, so there was a lot of social interaction and mingling. So all these, put together is quite a potent recipe.
Right. And is South Korea seeing a similar situation, Mei Chun?
Yes. So we've had this is called the third wave, and this is expected to be the worst and the toughest to curb, because right now we're seeing many small clusters of infections all around, all throughout the country. Whereas the first wave, it was mostly in Daegu, and the second wave was mainly in Seoul, and both were traced back to one big main cluster, both church clusters. So in this case, in the church cluster, the government was able to do aggressive contact tracing to get a list of all the people in the church and preemptively call them up and get them to go for testing. That's why they were able to curb the spread. But in this case, the investigations are not catching up with the clusters that are happening everywhere. So you've got people who are going to golf, and then there'll be a cluster there. You've got people who meet friends, university friends going out, and then there's a cluster there. There are people going to church, there's a cluster. There are people going to sauna, and we have 2 sauna clusters right now. And then people going to aerobics class, people going to, even in work, Samsung has got a cluster, LG is starting one. We've got music class. It's just everywhere. So the authorities are finding it very difficult to contact trace right now. What was successful back then in the first 2 waves is somehow not working this time. So the cases we have today is the highest in 8 months, 583 new cases today.
Right. On that note, while countries are trying to contain the virus spread by curbing activities, it's also not economically viable to remain shut. So Claire, what is Hong Kong's strategy, so to speak, in opening up?
Well, I think opening up is not quite the right term. I say that because Hong Kong is one of the cities that has not yet undergone a lockdown, and that's unlike Singapore, of course. And if Chief Executive Carrie Lam's words are anything to go by, so she said yesterday that lockdown is not on the cards, but that's different from what the experts are now saying, because she revealed that she wants a target of 0 local transmissions, and to do that you need to have strict rules, possibly even lockdowns. So the latest measures now are basically forcing bars, pubs, nightclubs, party rooms and saunas to shut from today until December 2. And then you have the bars and pubs are clearly unhappy because they're saying that the clusters that we are seeing now are mostly to do with the dance clubs. Dance clubs are, like a mix of dance studios and party rooms. The Thais go there to dance, and you can have food and drinks, so mask off, right? So the bars and pubs are upset because up to about 1,000, half of the 1,400 licensed bars and pubs may have to fold if this situation prolongs. Also, you've got larger restaurants. Why do I say larger restaurants? Because they hold banquets for festivities, Christmas, things like that. And if they're not allowed to hold banquets, now it's capped at 40 people in a banquet. I mean, that's going to make things very hard. In terms of tourism, though, there's a little bit of a respite, I guess, in that sense, because Mrs. Lam announced on Wednesday that the tourism sector will get funds of $600 Hong Kong million because it's the hardest hit.
Right. What about South Korea, Mei Chun? Because I understand that the country also has not used lockdown as a measure to contain the virus.
That's correct. That's correct. From the beginning, the South Korea has maintained that it will not resort to lockdown. What it does is it chases after the virus, to try to curb the spread. But right now, what's happening is that we are seeing waves, and these waves are happening because you have social distancing, right? So the levels are intensified, they are raised when the virus situation gets bad, and then because of economic considerations, they tend to ease it at the most fastest time possible. And then when the social distancing is eased, what happens is people think that it's safe to go out, right? They think it's, you've been tired of not going out. You want to go out and enjoy, autumn. Everyone goes out to enjoy autumn leaves. So the thing is, when this happens, you raise, people stay at home. When you lower back to level 1, people go out. And when people go out, what do, right? They drink. They have meals, and when you do things like that, you remove your mask. Yeah. And because the government keeps saying that, avoid big gatherings, so people started to have small gatherings. And what's happening now is it's starting to spread at all these small gatherings because people let their guard down, I know everyone here, so there's no need to wear a mask, right? So this is leading to this latest third wave, and this is very serious because South Korea is going to have its college entrance exam next week on December 3rd. And this exam is a make it or break it for students aged 19, the last year of high school. Yeah. So the government is appealing to everyone to not go out this weekend. Please stay at home. They're also telling the students who are in the last leg of the preparations for the exam to not go to tuition centers because tuition centers have become a cluster. So you can see this vicious cycle is happening over and over again, and that I think is the reason why South Korea has not been able to contain the virus. And until they can actually bring the cases down and then maintain, consistently, I don't think you can think about opening up the borders.
Right. Now, Mei Chun, Claire, Singapore is preparing to enter phase 3 of its safe reopening, but the authorities have said that to do so, we need to fulfill certain criteria, including keeping local case numbers low and capitalizing on technology to boost contact tracing efforts. Taking in what experts have told you about the situation in Hong Kong, what lessons can be drawn, you think, for Singapore in our bid to resume more activities, Claire?
Well, I've said it before on this show, actually, and I'll say it again. Now, people in Hong Kong operate on a DIY basis. What do I mean by that? I mean that they do it themselves. The government is not very prescriptive. And so, even if before the government gets very prescriptive, when the numbers go up, people are very aware here. They will avoid going out. You see less crowded streets. That's not to say that there's no fatigue. I think right now we have fatigue, which is why in October the numbers went up because there was a lot of socializing. People are tired of staying away. So, there's a ground-up approach which stems from the environment here, right? As opposed to a compliant population back home where people only act when the government instructs. So from Hong Kong's experience, the government is very reactionary. So then it lies on the individual. And things like good hygiene, wearing masks, less mingling, and if you're sick, see a doctor. A good point that the respiratory expert, Dr. Leong Chi-Chiu, made when I spoke with him was that any activity can spark off local spread. And like Mei Chun said, she was talking about how you have clusters everywhere. And that's exactly his point. He's saying that, he basically urged the Hong Kong government to impose restrictions on a wide range of activities. Why? Because, it's not, now we have the dance club cluster, but dancing is not the only activity that can spark off a cluster, playing mahjong. They like to do that here, mahjong clubs. Going to party rooms, which is now why they banned party rooms, because, people here were going to hotel rooms, staycations, right? And then they were holding gatherings in party rooms and things like that. So he's saying that you need to impose a wide range of restrictions, that will cover activities which will then in turn cover the entire population. Things like face-to-face classes, out of the window, working in the office, maybe they can work from home instead, non-essential or religious, recreational activities, weddings, that kind of thing.
All right. Mei Chun, your thoughts, lessons that we can learn from the situation in South Korea?
Okay, experts are now saying that the government's measures were not effective to begin with, and that they eased the social distancing too fast because of economic concerns, and that's why you have this yo-yoing wave of infections. So I think it's better to be safe than to be sorry, and that even if it's hard, to bear with not going out, staying at home. It's better to be safe than to be sorry. And over here, one more thing that we have that Singapore doesn't have is winter. So during winter, the reason why experts are so afraid that this would become the worst wave is that winter limits people's activities outside. You tend to go, you tend to stay indoors, and then when you stay indoors, you are in a place where there is very bad ventilation. You don't open the windows because it's cold, right? You're letting cold air in. But the thing is, an environment like that allows virus to thrive. And imagine going to the gym and then it's all underground, and then windows are not open. You sweat, you dance aerobics or Zumba or whatever, and then you spread the virus. So I would think avoid indoor places. Try not to meet your friends too often. Now they are suggesting that meetings should be kept under 15 minutes. And increasingly, I see people when they meet at coffee shops. Right now, they're not. Coffee shops are the cafes are only allowing delivery and takeouts. But before the social distancing was raised, I see people hanging out at coffee shops, and if they're not drinking, the mask is on. So that is one way really to keep yourself safe.
Right. Well, thank you so much, Claire and Mei Chun, for setting aside time to come onto the show to share more on the situation in Hong Kong and South Korea. That was the Straits Times' Hong Kong correspondent Claire Huang and South Korea correspondent Chang Mei Chun. You can read their stories on straitstimes.com. Elsewhere in the region, Thailand recorded its first tourists last month since a ban in April to avoid the coronavirus outbreak. But just 1,200 travelers visited the Land of Smiles, a fraction of the 3.07 million arrivals in the same month last year. Thailand plans to restart talks with China on a travel bubble, but the country has yet to agree to any arrangements. The Philippines will sign an agreement tomorrow to buy 2 million doses of COVID-19 vaccine from AstraZeneca. The government aims to vaccinate as many as 30 million people a year to achieve immunity among 75% of the population.